Hey friends, welcome back to the channel. This is Dr. Hassan here. Sorry, I was a bit busy these days, so I just couldn't make a video. So I really hope you guys have got some understanding of the non-clinical pathways, which I discussed in the previous video. So today's video is all about the clinical pathways for doctors and other healthcare professionals to work in UAE. Before continuing further, please don't forget to subscribe my channel so that you don't miss important content. So let's begin with the most frequently asked questions. How can you practice in UAE as a licensed doctor? What type of exams do we need to take? What are the requirements for it? What is the eligibility criteria? So I will try to answer all of these questions one by one. So stay connected. First of all, you should know that there are 7 Emirates in the UAE: Dubai, Abu Dhabi, Sharjah, Ajman, Ras Al Khaimah, Al Queen, and Fujairah. So there are different exams for each of the states. For Dubai, it's DHA. DHCC is for Dubai Healthcare City. For Abu Dhabi, it's Dha Haad, which is now called DOH. For all the other 5 states, you need to take MOH if you want to work here. So you need to be an MBBS graduate or equivalent recognized by the Healthcare Council, or if you are an international graduate, then your university or college must be recognized by WHO or FIMER. Second thing is your internship or house job, which is called in some countries. You should have 1 year house job. The third thing is 2 years of post house job or internship experience. Congratulations, if you have all the 3 requirements, you are able to work in UAE. But it doesn't end here. You need to complete further requirements as the journey starts now. So the further requirements includes valid passport, which should not be near expiry. You should have your passport size photographs and experience certificates. You should have your good standing certificates, which should not be older than 6 months. And good standing certificate is issued by the Health Council of the respective country. If you want to apply for the surgical specialties, then you should have official logbook. You should have your healthcare professional license issued by the respective medical authority or council. If you have all of your required documents, then you need to proceed to the next step. The next step is you need to register yourself in the respective healthcare authority of UAE. After registering yourself, you need to have your primary source verification. Now at this point, a lot of confusion arises in many minds. What is primary source verification? Don't worry about that, I will try to clear them. Primary source verification is basically a verification done by an organization or I say company called Dataflow, which is the global provider of primary source verification solutions. Basically what they do is they screen all of your documents to minimize frauds and other risks to maintain the transparency. Okay, so another point to be noted is primary source verification is done only once at the start or at the beginning. You don't need to get yourself verified again and again. If you want to shift to some other licensing authority, like for example, if you had made your mind of taking DHA and living in Dubai, but now you want to take DOH and live in Abu Dhabi for some reasons, so you don't need to get yourself verified for the second time. Primary source verification takes about 4 to 6 weeks. They basically verify all your documents, including certificates, degrees, good standing certificates. After the verification is done, they will provide you with a new username and new password, which you will use to log in into the respective healthcare authority in which you are applying. So there are some other points which you need to remember is that you can convert your DHA license into DOH license and vice versa. You can also work in Dubai Healthcare City with DHA license, but you cannot work in other places of Dubai with DHCC license, because DHCC license or Dubai Healthcare City license is only valid for the Dubai Healthcare City. Another thing is you need to renew your license every year for the state which you are holding. For example, if you are a DHA license holder, you need to renew your license each year or every year. The test centers are located internationally. They are located in most of the countries around the world. So these were the some common points which are same. So thanks for watching today's video and bearing me. I hope this video proved to be helpful for you.